Requesting Good Company. This is our second installment of our career highlight segment, where we highlight careers of people that we know so that others and our viewers can learn about different career types. Today we have two nurses, Molly Metzger and Jasmine Sweat. They are going to be talking about their careers. Part one of our two-part nursing segment is an interview with my sister, Jasmine Sweat. I've known Jasmine Sweat for all of 30, going on 31 years, my whole life. Let's roll that beautiful family footage. Welcome to Requesting Good Company. Jasmine, I appreciate you taking time out and speaking with us today.
Yeah, right.
So, Jasmine, my first question is, what is your job title? And give me like a basic rundown of what you do.
All right. I am a LPN, which is a licensed practical nurse. In some states, it's a LVN, which is a licensed vocational nurse, licensed by the state of Florida, whatever state you're in, to take care of patients, direct patient care, medication administration, wound care, advanced life-saving situations. That's where we are with it. There's different levels of nursing, from nursing assisting, patient care techs, to your RNs, to your BSNs, to your nurse practitioners, and I'm in that lovely smooth spot. You find LPNs most commonly like at the nursing home, definitely taking care of like your granny now. Depending on what state you're in, it dictates what all you actually can do.
I was telling somebody today that when I was getting ready to interview Molly today, and they kept asking me like, "Well, what does your sister do?" And I was like, "Oh, I'm about to find out though." And you
Well, see, the thing is, like, I've been doing since I've been a nurse for like 8 years now, and before that I was a CNA, and you would always find me like at a nursing home and those things like that. So when I got my LPN, it was nothing to do become a nurse on the cart, which that's the charge nurse at skilled nursing facilities and ALFs, assisted living facilities. So from there, I branched out into like step down units, like you're well enough to be discharged from the hospital, but not well enough to go home. Orthopedic floors, for those who are have serious surgeries that are learning to walk again. So I feel like I've touched a lot of what I can. In the state of Florida, you have to be certified in more advanced things like wound care. So I did wound care nursing as well.
So, Jasmine, what made you get into the nursing field?
I got into the nursing field because of you, Avery. When you were younger, I was present when you had your first seizure and everyone was panicking. And in their panic, I was just thinking on how can I help you? How can I stop this from happening? No one had the answer. And as you were taken to the hospital and you were going to your doctor's appointments, and I was seeing the nurses that were coming in and attending to you, you were getting better. And those answers were given. Now, at the time, I didn't know the words. I did not know medical lingo, but I did know that there was a career path that could take you from a horrible experience in the back seat of the Camry or the Blazer, one of them, and bring you back to the boy that was running around annoying me. No shade.
So, what would you say is your biggest takeaway or your best feel-good moment?
My biggest feel-good moment, biggest takeaway is when I worked community health. I was able to be a nurse to folks that are older, already gone through their life, but what they didn't know was what was going on with their body physically. Um, Having the opportunity to give healthcare to those that weren't aware of hypertension or diabetes or what is it doing to their body. The joy of watching them start with lab levels that were completely abnormal and constantly being sick to able to assist them in understanding and getting the treatment that they need to a better place. Um, I think sometimes when you've already been afforded things, you don't value the fact that there are people out there that do not know how it's important to um, have your labs checked, continue to go to the doctor, to have those checkups. And then at this particular clinic I was at, insurance was not a problem. It wasn't a discussion. You have a need and we are here to address it. And I think that's been my most fulfilling experience as a nurse.
Jasmine, can you give me like what a everyday day looks like for you as a nurse?
I work at a multidisciplinary clinic and I am leading a RPM program, which is remote patient monitoring. Patients that have advanced stages in their comorbidities like hypertension, chronic heart failure, um, obesity, they are given a device, either a blood pressure cuff, glucose monitor, or a scale. And I have at least headed onto a good group of 200 patients that I'm monitoring every day. I'm considered on paper to be their personal remote patient monitoring nurse. So outside of my other tasks where I'm like just doing nursing care within the clinic, that is my baby right now. And also, I do home health care with pediatric patients overnight, giving those parents a rest, but also able to help those little babies that are, I don't know, have serious conditions.
So, Jasmine, what kind of schooling did it take to get into the position that you're in?
It took me, I was in a 15-month program. Depending on the school that you're going to, it could be from a year to 2 years. It's a diploma program for your LPN or your LVN, and then you'll test in your respective state with that nursing board.
Jasmine, what would you consider your hardest day of nursing?
Um, I have two instances. First, when I first became a nurse on the cart, had a rough day because it is important to have time management, well, good time management skills. So that was probably a hard day. But as you go through your career, you learn the tricks of the trade and that dissipates. Probably the toughest, most heart cringing is typically when patients pass. You've been caring for this patient for how long, depending on your setting. So you've seen the process of death and dying. That is something that you will become, I don't know, it becomes relevant in a nursing career. But interacting with the family at that time, those have been some rough days for me.
Fair enough. Jasmine, is there any literature or um, anything that people need to look at if they're thinking of getting into nursing or getting into the field?
There are so many outlets of describing what each level of nursing is, what setting. I would actually encourage anybody that's thinking to get into nursing to go to whatever school they're looking at and read the profile um, about graduation rates, the setting, pay. You could always volunteer at facilities. Uh, Candy striping, which is an old term, but being an aide in those things. Some nurses started in the field just straight out of school. I didn't. Started as a nursing assistant. It got me comfortable with touching other people. Not in like a weird way, but that's what it did. It made me comfortable with interacting um, with somebody in the whatever state they're in. Yes, we look great in scrubs. Yes, it's a rewarding career, but it's work.
Work.
It is work. Yeah.
As you said, like it's work. What would you say some of the struggles are like in the nursing field? We've talked about the death and we've talked about it being work. But what would you consider a
Mhm.
struggle for somebody who is looking to get into this career?
Um, there is a certain level of stress when it comes to nursing. You are an advocate for your patient. You are sometimes that voice between the person laying in that bed and the doctor. Sometimes one big thing about the nursing career is that the patient nurse relationship, there is sometimes another step of compassion because you're not only going to administer medications, but you're looking at this person. They're telling you, "Oh, I'm hungry," or "I'm uncomfortable." You're taking care. It's a holistic type of job. Yes, I can read a report, but I have the pleasure of knowing Mr. Jones or Mrs. Adams. I'm able to take that black and white
Put a
order from the doctor and put a face to it. Yeah. As a nurse, I learned rather quickly that I'm there's a high percentage that I'm going to meet someone not on their best day. Okay. So my goal outside of what is required of me and my licensure in the facility that I'm working for, my goal is that 8 hours or that 12 hours or that 4 hours, because sometimes your shifts are short, and sometimes they're long. My my goal and my purpose is to make sure that my nursing touch, your experiences with me, is as appropriate and as enjoyable as I can make it. Um, Sometimes you won't know what happened outside of a report, what happened to that person the shift before. And unfortunately, you might not know what happens to that person after I clock out, but I know that that time that I spent nursing this person um, is a good experience for them. As far as my career goals, I would encourage anybody that is working from nurse aide upward to continue to push forward. With each licensure, you get that little bit more pay, but you also get the ability to do more in the field and touch more sectors of it. Um, my goal is to get my RN. So for those who are LPNs, there's a bridge program. That is what you would want to look for if you want to further your licensure. It's typically just a year. Uh, Sometimes you get in the field, you get working, you start making that money, and you stay there, which is fine because that might be what God's telling you to do. But if you aspire to go even further, there is a bridge program, LPN to RN. As you already went to nursing school, and nursing school is as tough as they say. So you're already aware of that, but you're also coming with a stack of knowledge that's going to fuel you when you get your RN. So next time on the podcast, that's what I'll be.
So the last question is, what words of encouragement, or pretty much your broad statement to the people watching Requesting Good Company? What is your statement? What is your words of encouragement by Jasmine Sweat?
There is only one you, and you are purposed. And I would encourage you to seek that out. That's it.
Well, Jasmine, I want to thank you for being a guest on Requesting Good Company. I really
Yeah.
appreciate you taking time out of your day to talk with me.
Oh, thank you for letting me get on here. Shout out to all the nurses. Yeah.